Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Hello, I'm Dr. Bob Russo, the Executive Director of the Connecticut State Medical Society. The Connecticut State Medical Society represents 4,000 physicians in the state of Connecticut. Our mission is advocacy for the physicians and their patients. Today's topic is going to be the ambulatory surgery centers and its effect on the practice of medicine in Connecticut. Our guest today is Dr. David Emmel, an ophthalmologist and the chairman of our legislative committee at State Medical. Welcome, David.
Thank you for having me on, Bob. It's a pleasure to talk to you today about ambulatory surgery centers and specifically with regard to the ambulatory surgery tax. Just by way of information, surgery centers, ambulatory surgery centers are a very safe, cost-effective, and convenient way to undergo procedures, both diagnostic and therapeutic. They're increasingly being used for a variety of reasons in fields like ophthalmology, my own field, ear, nose, and throat, dermatology, vascular surgery, orthopedics. A lot of procedures are very amenable. And of course, colonoscopy, endoscopy, a great variety of procedures and growing all the time.
So tell me a little bit about what drove the beginnings of ambulatory outpatient surgery centers in private practice.
Well, I'll tell you, for me, back 20 years ago, I was a group of a dozen ophthalmologists who met and talked about starting our own surgery center. And the more we talked, the more we realized that we all had similar views on what would make a more patient-centric experience, something that would run smoothly, efficiently, and optimize the quality of care, as well as provide a cost-effective alternative for patients. And we were able to build that and do that and produce an extraordinary result.
Yeah, I've noticed over time that particularly commercial payers, Medicare and other payers like that have kind of pushed to cost savings. Can you give me a little bit of an idea about the cost savings in a surgery center like the ones you go to versus in-hospital surgery centers?
Well, it all falls on the facility fee, which for a hospital can be multiples higher than it for an outpatient surgery center. So the cost to either the insurer or the patient is significantly less for an outpatient surgery center. And that's particularly important in this day and age where we're dealing more and more with high deductible plans so that the immediate burden of cost falls on the patient. It can make a huge difference.
I understand from Medicare that there's approximately a $70 billion savings using these centers versus the hospital-based centers from now until 2018. Do you feel that that's a valid number?
Absolutely, and there's I can assure you it will only increase. The efficiencies are there, the opportunities are there to deliver, like I said, high quality care more efficiently and at lower cost. In our facility, which is a one specialty facility, every member of the team knows exactly what they're doing. It's like a ballet or clockwork. Everything happens in a very precise order, very smoothly and efficiently. It's a very like as I said, patient-centric experience where the patient comes first. Parking is easy. The patients are treated in a very friendly manner. And I think this is a fairly universal experience for outpatient surgery centers.
Yeah, I believe that having, unfortunately, at my age, been in them, it's more comforting. It's easier to walk into a physician's office, walk into a surgery center as an outpatient outside of a hospital, the tension of a hospital, the busyness and things like that. I mean, it's a comfortable experience. I think when you use the term patient-centric, that's one of the biggest things. How comfortable are the patients? How secure are the patients? I think that's a very significant deal.
Anyone who's had a colonoscopy or any of these procedures know they're very stressful, and anything we can do to make it easier and more comfortable for a patient is a huge benefit. People defer care when they're anxious and find that the experience is stressful. So on top of this now, the purpose of this podcast is to talk about the surgery center tax, which in Connecticut is 6%, the highest in the nation. We're one of only 4 states that has a surgery center tax. And the 2 states, Rhode Island and Florida and Wisconsin, repealed theirs, and Florida's was deemed unconstitutional, but none of those taxes were as high as Connecticut's. And Connecticut's tax is a gross receipts tax, which means every dollar that comes in is taxed, including dollars that go directly to the payment for supplies and prostheses, implants that go into knees, eyes, whatever, which can be very expensive, are taxed, even though it's not part of a surgery center's profit.
I've also noticed that if you look at Connecticut versus Rhode Island, when we're looking for young physicians to come into the state of Connecticut, competition for these young physicians is important. Now that Rhode Island's repealed its tax, if you wanted to move into New England, taxes like this, which are extremely unusual around the country, would make you, if you're on the eastern part of Connecticut, pick Rhode Island, because you don't have the problems that, say, recently our surgery centers have had. When COVID came and the volume of these surgery centers went way down. And again, as you pointed out, it's a gross tax. So you're still paying rent, you're still paying for equipment, you're still employing people. It actually put a lot of them into the red. And there's no ability in these surgery centers to cost shift. So you can't take the money from here and put it over there like some other institutions can do. So I'm a little concerned about what drives young physicians out of Connecticut. Can you say a little bit more about that?
Oh, there's no question that it occurs. Some of my ear, nose, and throat colleagues have interviewed extremely talented candidates from residency programs, people who are interested in finding a permanent spot to settle down, build a practice, and raise a family. And they said, we decided to go to another state because, among other things, the opportunities were better to be a participant in a surgery center. Whereas Connecticut is perceived as being not so to provide the opportunities for a young physician. And it stunts the entrepreneurial spirit. I mean, physicians have broken a lot of ground in terms of developing surgery centers. And there may be other opportunities out there where physicians, if they're in control, can contribute significantly to advancements in both the science of medicine and treatment.
Yeah, I do believe that in that setting, the physician as the head of the medical team feels more confident in practicing medicine and not practicing some of the other pressures that people in other settings have. So again, I do think that these surgery centers are absolutely necessary. It's very good for patient care and comfort. So I do want to thank you for your time today and taking you away from your practice, and appreciate all the hard work you do for State Medical and the patients of Connecticut. Thank you again.
Thank you, Bob.
Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.